So today I have a pathology class from 5 p.m. So the topic of the class is bleeding disorders. So now I'll be starting with the class. So let's get started.
Good evening, students. Yes, so we'll continue with our, just a minute. I'm just checking audio video. I've not taught anything until now. So what you can do is you can just forward your video now. So just forward your video so that everybody comes in sync.
Okay, so my class just ended and these are my notes for bleeding disorder. So the class was very conceptual and I got to know like various new things and I understood almost all of them. So sir teaches in a very good manner through flowcharts and diagrams, and as you can see, my notes are full of flowcharts, differences, short points, and it was a great class. So in any topic, we have the pathogenesis, then we have its types, then we have treatment, and like there are very simple diagrams, and it is great to understand the topic. As you can see, there were flow charts with diagrams, and so these are my notes. I've made them completely. So that's all. So now what, after attending the class and making the notes, I'll be practicing some questions. So here you can see my screen of eMedicoz. So I'll be going to my courses and the batch name is pre-foundation course. So in that we'll go to courses and there we have DAMS question bank, which is DQB. So I'll go to pathology question bank, and in pathology we did bleeding disorder. So I'll be practicing questions for the same. As you can see, there are clinical vignette, and then we have bounce back, systemic pathology, and then all the chapters of general pathology, including hematology. So we're going to platelet disorders in hematology, and let's practice some questions. Let's start the question bank. So this is an easy question. So let's move to another question. So this too was covered in the notes, so I just read the explanation and then I'll move forward to another question. So this is something I'm confused in, so I'll just mark what I remember. Okay, so I'll bookmark it, read the explanation, and then come back to it again to revise the topic. So that's why DQB is a great source for revision and to assess yourself. So similarly, I did other questions too. As you can see, the explanation has diagrams from Robbins and the facts from Robbins itself. Alongside the question bank, we have concept books. So there is a hard copy of concept books, and here there are talking concept books. So I'll be seeing them now. It has all the subjects like OPTHA, PSM, ENT, then you have surgical subjects, and here are the paraclinical subject wherein I'll be studying pathology. So it has talking concept books of all the chapters, and there are also talking CRs of all the chapters. So now I will be seeing the video of talking concept books of bleeding disorders. So let's get started.
So let's have a look at the platelet and the coagulation disorders now.
Okay, so this is a concept book, like as I started with disorders of hemostasis, bleeding disorders. So this is a concept book, and this is the talking concept book where sir is explaining the things given in the concept books, not in a detailed way because that was covered in the lectures, but an overview for revision purposes.
So basically, I'll start with the basic the concepts in the manifestation of the bleeding.
So as you can see, there are flow charts, there are diagrams, then again there are flow charts. So it is a kind of revision thing, and it is great for revision after you have completed a topic.
So we all know about the primary plug and the secondary plug disorder. So basic things, let me first talk about this. So in which there is, PT is, okay.
So as you can see, it is very concise form, and it is really helpful in like understanding a concept, in revising your concepts, or after seeing a lecture. So it's good to go through it. Apart from the video lectures, DQB, concept book, CRs, we also have practical courses. So in the pre-foundation course, we got PSM practical course, ophthalmology, pathology, microbiology. Then we have DAMS integrated MCQ round. Then we have infectious disease. Then we have first professional class subjects practical course. Then we have ENT. And so these were the practical course. So in practical course, I will be going be seeing pathology. So in pathology, I'll be seeing bleeding disorders cases. So in this, ma'am will be teaching all the possible cases in the bleeding disorder which can come up in practical. So as our practicals were not fully covered during the lockdown, this was a great initiative to complete our practical part. In the systemic pathology, we also discussed gross images, microscopic images. In microbiology, all the stainings and all the practicals were explained. Similarly, the case was another subject too. So as you can see, different cases are being discussed along with small points which come up in the practical. So it was a great class overall, and the addition of the practical courses in the course has been a very effective method of teaching for us. So that was all for today. Hope you found it useful.